juggle them. I'm going to look over at my comms folks to see when they're ready. Ready? Okay. All right. So thank you all for attending today. A really important opportunity for us to increase awareness about the benefits of and availability of 988 as a call center, but also as an important first step for us as the state of building a statewide crisis response system that is not only capable of responding to a crisis, but also preventing one. My connection to this, like a lot of folks have a connection, is prior to my time in state government, I worked as an emergency medicine physician as the medical director of the Indiana Poison Control Center. In both of those settings, you're confronted on a daily basis with the impact and outcomes of untreated crisis, whether that be suicide, a suicide attempt, whether that be an overdose, or whether that be really a mental health crisis without available resources. And as somebody working in those venues, day after day, we would see the increasing number of cases coming in. And at times you can feel a little bit hopeless as you see the numbers and all of the data increasing. And you start to ask yourself, what can we do about this? It's such a complicated issue, and our systems at that time were so complicated. You really start to wonder, how are we going to bend or break that curve? But really, we're here today to talk about a first step in doing that, and that is 988. And it's why when I stepped into the role of secretary with the governor's office support and the leadership of Jay Chowdhury and the Division of Mental Health and Addiction, we made the launch of 988 last summer the first part of building this statewide system. And I think we can all start to see how this really can have an important impact. For one, is we have our call center assuring that an individual in crisis has a safe place to call where you're going to have a trained professional and an empathetic ear. But we know that a comprehensive crisis system has to have more than that, because there are going to be individuals who call who are going to need more resources than we can provide on a telephone. And that's why we're building out crisis response systems as well, to make sure for those individuals that we have teams of trained professionals, mental health professionals and peers who can go on site and provide services. And for those individuals who need more than that, it's also why we're investing in having locations around the state that can specialize in crisis care and management. And so with the ongoing support from the legislature and the governor's office, we are really on our way to having a statewide crisis system as we continue to build towards that in the 2027-2028 timeframe. And so since we launched 988 last July, we have seen tremendous benefits already, both in the number of folks who are reaching out to call to us that we can help, but also in our numbers. So we are Indiana routinely is in the top 5 states for our in-state answer rate for 988, and we have been over 90% since November. And a big part of that has been our leadership in the Division of Mental Health and Addiction. I'm going to ask Jay Chowdhury, the director, to come up and talk a little bit more about the system.
Thank you, Dan, and good morning. So the idea of 988 was around for a while at the federal advocacy level, and it was always referred to as N11, right? So some number ending in 11, similar to 811, which is call before you dig, I believe, and 411, 211, and the advocates were very pleasantly surprised when they heard that 988 was being considered, because to them, starting with a 9 meant that this system and behavioral health and mental health would be treated at the same level, with the same level of resources and focus as 911, which of course is our system for other emergencies. And when you think about 911, you don't just think about the call center, right? You think about the ambulances and EMS and the emergency room and law enforcement and public safety and fire and the whole ecosystem that functions with 911 as its core. And that's what we're trying to do with 988 here. We're using the change to 988 as a springboard to build a whole system to respond to behavioral health crises. As Dr. Dan said, the three parts of the system are someone to respond, someone to contact, someone to respond, and a safe place for help. And Kara Byro is here. She'll talk about the first part of that system, the someone to contact, after me. And so we've invested a lot of federal funding, as many of you know, in pillars 1 and 3 of that system, right? So the 988 call centers, and we just announced $57 million earlier this summer in grants to centers around the state to build that safe place for help, which is a physical location where individuals can be taken for follow-up care. And you also probably know that the General Assembly made behavioral health their priority last session and invested $50 million per year in new money in this comprehensive crisis response system. And we're very grateful to them for their partnership. And what we're still working out a lot of the details because this is complicated and requires sort of seamless collaboration, both at the local level and between locals and the state. But we are focusing our efforts primarily on pillar 2 of that system, which are mobile crisis teams. And these are mental health focused teams that can respond to crises in the community, which is really important, in the community, not in a physical location. They go out to people, meet people where they are, these are peer led, oftentimes, but led by behavioral health professionals, most importantly, that will look different depending on where they are, but they'll share a common thread of delivering therapeutic, evidence-based, culturally competent crisis response services around the state. And so last year, we started this effort by launching 4 pilot programs, which are well underway and going on about 100 calls a month, kind of give or take, depending on what happens. And we're learning a lot from those pilots. And our first step in the process will be using what we've learned to expand. Like I said, the details are still being worked out, and we look forward to sharing that in the future. But there's a few principles that we're gonna follow as we're building these systems out. The first one, and this is really important, our system is built on the philosophy of no wrong door. This is really important. This means that no matter who you are, what your crisis is, what your diagnosis is, whether or not you can pay, our system will be available to you. And our providers understand that that's our baseline expectation, that they have to help anybody that comes to them for help. And second, and this is really important too, we firmly believe that communities need full crisis continuums. And that means a mobile crisis team and a crisis stabilization center in the same community, because we know that a mobile team without a place to take somebody that needs more help, or a physical location without a community outreach component, are not going to be as effective as those working together. And so our next step, and again, we look forward to sharing more details soon, is working with our crisis centers, crisis stabilization centers, to add mobile crisis to their services, to ensure that where there's partial crisis continuums now, there will be full crisis continuums in the future. And then finally, and also very importantly, I guess 3 important points, we know that a lot of this work, all of this work really has to be done sort of with seamless collaboration at the local level, while also rolling up into a statewide infrastructure. We're building a crisis system not for this year or next year, but so that Hoosiers in 2033 will have a crisis system to rely on. Our model that we use is the Arizona model that we're kind of borrowing from, and for them, this has been one of the biggest takeaways, which is that ultimately, a lot of this has to be sort of funded by existing infrastructure, whether that's Medicaid or other things. And that's why they've been around for 20 years. And that's our goal. So, but the success we've had and the progress we've made is 100% attributable to our amazing team at DMHA, and Kara Byro kind of leads that team. And so I have Kara come up and give you some more information about the first part of the system.
Thank you, Jay. And thank everyone for being here as we talk about such an important topic. As Dr. Rosiniak shared, last year we went live with 988. So July 16th, 2022, phone carriers were required to ensure that individuals dialing 988 were connected to the Suicide and Crisis Lifeline. This is a huge shift from the transition from a 10-digit number to a 3-digit calling code. And the reason this is so important is because it took us from a larger number that people had to remember and a focus on suicide to a focus on suicide and crisis, meaning that individuals could call this easy to remember 3-digit number when they were experiencing any sort of mental health distress, including suicide, but not limited to, and including substance use or any other mental health crises. So you might be asking, what is 988 as we talk about the difference and the change in that? So I think the most important thing is that 988 is a way forward. You heard Dr. Rosiniak and Jay talk about how this system is the first part of an entire crisis continuum that our state is building, and it ensures individuals have access 24/7 to a free suicide and crisis lifeline where they can talk to trained crisis specialists to support them in whatever way they need. This crisis lifeline provides direct connection to those trained crisis specialists who offer an accessible care and support, and for anyone experiencing any mental health crisis or substance use crisis. This is about meeting the individual where they are and ensuring that we support them regardless of what that might look like, and ensuring autonomy as well as collaboration to reach the support that they need. Another important part about 988 is that this is a confidential system. So it allows individuals to call 988 and talk to an individual without having to share too much about themselves. An individual might be asked why they're calling 988, just so that the crisis specialist knows what skills to hone in on and how to best support that person. But an individual's openness to sharing any information about themselves is really up to that individual in crisis. So in the state of Indiana, we are partnering with 5 local call centers and providers to focus on ensuring that individuals in the state of Indiana receive access to 988 and are answered by individuals within the state of Indiana. Those crisis specialists working at those 5 centers, again, are trained and go through a crisis simulation test to ensure that they're able to meet the needs of an individual and to support someone through any event of crisis that they might be experiencing. Those crisis specialists provide a listening and empathetic ear to an individual who might be experiencing a crisis and provide them connection to helpful resources, as well as ensuring and connecting them to any sort of crisis intervention that an individual might need as well. So now you might be asking, what is a crisis? Another really big thing that we're trying to ensure the community is aware of is that we're not defining what that crisis is. It is not up to me to define when you're in a crisis. What is a crisis to me is very different than it is to each and every one of you that are here today. It is important to ensure that our community and the people in our state feel that no matter what their crisis looks like, no matter how big or small, that they can reach out to 988 for support. So a crisis might look like a new job, struggling with money, relationship problems, family problems. Again, it does include thoughts of suicide as well as substance use crises as well. But no crisis is too big or too small to reach out for support through 988. So next, what I would like to do is to share with you all a video that defines what our call centers are doing and what our mobile crisis teams are currently doing to support the individuals in our state who are experiencing any of those mental health crises. You'll hear from one of our individuals that oversees our call centers, as well as someone from our mobile crisis teams. And I think there's no better group of people to share what our system looks like and how we're supporting individuals.
I have always been passionate about suicide prevention for as long as I can remember. And I did lose somebody to suicide. As 988 became available, I wanted to be a part of that movement. Losing somebody to suicide is incredibly difficult, but it definitely has fueled my purpose today.
my parents. Both of them were just in active addiction. I think if we had 988 available, if there was mobile crisis teams available, there would be some members of my family that would have been able to get the help that they needed, and maybe things wouldn't have transpired in their life.
988 means to me helping more Hoosiers. Those who maybe are uncomfortable speaking about their crises because of a stigma now have a place to go and reach out for help that's confidential.
I think sometimes that there's still a stigma on mental health or even substance abuse. And I think we've seen since COVID, just the need of people knowing that there's somebody out there for them to talk to and knowing that they're not alone in whatever it is that they're facing.
It's truly beautiful to see the amount of people that call and the wide variety of reasons why individuals call, and that they find hope in reaching out to us.
Sometimes somebody just wants somebody to talk to and hear them out. And I think Hoosiers really need to understand that that's what that's for you to not have to deal with everything on your own.
It is incredibly rewarding to see my staff successfully navigate 988 calls. I love reading the reports. I love hearing the stories. I love receiving emails from my staff saying how proud they feel because of a successful call. And that means a lot to me. That really fuels me even more than just suicide prevention.
So as I think you've heard and have seen the importance of 988, it's now equally as important that we make everyone aware of what it is. That's in part why we've launched our media campaign, where you'll see commercials like this. Try it again.
What is 988?
It's a way forward.
It's a free 24-hour suicide and crisis lifeline.
It's someone who gets you.
It's a listening ear.
It's whatever you need.
Even when you don't know what you need. If you are experiencing thoughts of suicide or a mental health or substance use crisis, call or text 988. Learn more at 988indiana.org.
So how can you help? As the media, you can also help spread the word, both with individuals that you know, live with yourself, but also we would encourage you to link to resources that we make available in your articles. And when you're discussing this, you can go to 988indiana.org, and on there you'll see we have a resource page with a variety of materials that you all can use and share. So at that, we will open the floor up for some questions. We'll turn it over to Amy Duke, who's going to call you. By way of reminder, if you're in the room, you have to come up to the microphone to ask your question so that people who are watching online can hear.
Yes, we'll take questions from both in-person and virtual media in attendance. In person, please step up to the microphone when your name is called. If you're attending virtually, please raise your hand virtually and unmute yourself when your name is called. We're going to start with Brandon Smith from WFYI.
Can you hear me through this? All right, cool. So I guess I have a two-part question, Dr. Rusiniak. First, you talked about how this is a springboard. It was talked about how this is a springboard for the whole crisis response sort of system in Indiana. Obviously, there's a lot of building still to do on mobile crisis units and a place to go crisis centers. Is there more building to do with the 988 hotline itself? Do you want to get more centers, call centers in the state, that sort of thing?
Yeah, it's a great question. I'll touch on it, but then I'll have Kara come up and give a little bit more information. The short answer is yes. And part of it, step one, is awareness. We know with more awareness, and as we share this more, we're going to receive additional calls. There's also additional work that we can do around training and also making sure that all of our centers have the resources that they need. We are looking towards a time in the future where there'll also be text options available here in state. They're available nationally, but we'll be working towards that in state as well. I'll ask you to come up and.
So currently with our 4 call centers that we have, one is a chat and text provider that we are working to enhance and provide that chat and text in state. With those 4 call centers, they are stationed throughout the state. So in Gary, Indiana, Muncie, West Lafayette, and Indianapolis, all 4 of those call centers are on a single telephony platform, which ensures that they are able to answer questions or answer calls regardless of where they start or where they are initiated from. So the goal here was to ensure that regardless of where an individual lives in the state, they get access to a crisis specialist as quickly as possible. Obviously, prior to when the call centers were divvied up by counties, obviously more heavily populated areas experienced more calls, which meant a potential for longer wait times. So with going to a statewide platform, it allows us to ensure that individuals reach a crisis specialist as quickly as possible. And we're working to ensure interoperability across the entire system to make sure that individuals get the support they need.
And then my second question, and I think this is probably best for you anyway. I guess it's a two-parter based on something you just said. One is, can you just sort of explain that the 90% in-state answer rate was a goal, I think, from the beginning. Why is it so important? This may seem like a silly question, but why is it so important that somebody in Indiana is answering that call from somebody in Indiana? But then secondly, what is the average wait time that someone calling 988 in Indiana experiences?
Yeah, I don't think those are silly questions at all. I will say the average speed of answer is about 9 to 10 seconds right now. We have very few that are sent back to the national backup. So if a call isn't answered in state, it does have the opportunity to be answered and is answered at the national backup level to ensure that individuals get the support they need when they need it. Now, when you're talking about, excuse me, the why it's important for individuals to have their call answered by someone in Indiana. We like to say that if you've seen a county in Indiana, you've seen one county in Indiana, right? Same thing with states, right? Each state functions very different. And to ensure that you can get the connection to the resources you need, it's best if that's by someone in the state who has quicker access or understanding of what is available in our state. 988 looks different at each state, just as our mental health system does. So ensuring that accessibility.
Yeah, the only thing I would add also is by being in state, it also allows us to connect you to resources that may not be directly 988 specific. So 211, for instance, we share the same telephony system with 988 that we do with 211. And so if the thing that really accelerated your crisis was something like housing insecurity or food insecurity, we can deal with the crisis, but then we can connect you directly to 211, who will be able to tell you where in your local community those resources are that you might be able to use to not only help deal with the acute crisis, but potentially prevent future crisis.
All right, our next question will be from Camila Fernandez from Wish TV.
Hey guys, thank you so much. I wanted to ask if you are currently working toward hiring more individuals, interventionists at this time, and how is that looking like currently?
Yeah, I think Carol will be best to talk about from the 988 call center, and then maybe Jay, you can comment a little bit on the other part of that, which is the mobile crisis teams and how we're really looking at expanding those.
Bring this down again. So all of our call centers do all of their hiring individually at each of their call centers. We have some that allow their staff to work remote and some are housed in office. They're always hiring at this time. All of our call centers historically functioned on a volunteer status. So when we went from the 10-digit National Suicide Prevention Lifeline, they all functioned with volunteers only. So because of funding, they've been able to hire full-time and part-time staff. And I'm sure, it's taken some time, but they are all still currently in the process of hiring to ensure that all shifts are covered. And as we expect to see an increase in calls as our awareness increases, we anticipate that hiring will increase as well.
Yeah, and so we can't shy away from the notion that not just in behavioral health, but health and human services across the board workforce is a massive issue, right? It's finding the people to deliver this work. It's hard work. It can be traumatizing, right, to the people delivering it. I mean, the folks on our front lines here are absolute heroes, and we need to celebrate them as such. And so that's, I think, part of the message we want to get out there is that if you want a rewarding fulfilling career that we're going to venerate and elevate, that, this is something you should consider. But our, mobile crisis teams, the one thing I think we've done a pretty good job of, and are always continuing to work with our partners on, is making sure there's flexibility in terms of who's on these teams, right? And so, the teams can have a pretty flexible composition in terms of, they have to have a peer, because, as Kara, has said so eloquently, like, having a peer on site at a crisis is the key to de-escalation. But in addition to that peer, it can be EMS, it can be a behavioral health professional of various kinds. And so we're hopeful that flexibility will ease some of the challenges that otherwise might arise.
Yeah, and the only other thing I would add is, as you saw in our one video, is I think everyone at some point is touched by mental health crisis, suicide, substance use disorder. And so I do think what we're doing is so impactful that we'll also be able to pull from folks who really have seen the need in their own personal lives. And so I hope that we can continue through our awareness campaign also to encourage folks to enter the workforce.
And I just have one more question from my end. Would you say that currently the amount of staff that you have matches the current demand?
Yeah, it's a great question. So as we launched 988, we also with that really thought about, as we got everyone on a telephony system, and we got standardized training and all the resources, and then built an awareness campaign, that we were going to likely need additional staff. And what we didn't want to do is to find out that now we're getting a lot of calls and we can't answer them. So we have asked and been working closely with all of our centers to staff up in preparation really for what we really fully expect to be an increasing demand. So I think right now we're in pretty good shape.
Thank you.
Thank you.
Next, we have Ryan Martin from State Affairs.
Thanks. I have two quick questions. One is, as I recall, the General Assembly wanted FSSA to apply for the National Medicaid Demonstration Program. I'm wondering if you could provide a quick update on how that application
Yeah, I think
process is
Jay,
going.
that's a great question. I think Jay can comment a little bit about that.
All right, so just for clarity, I know you know this, Ryan, but what Ryan was asking about was the certified community behavioral health clinic model, which is kind of a new way of paying for and delivering behavioral health care, which is what we want to get to here. And there's a sort of a pilot program called the Demonstration that the federal government is allowing us to apply for. To answer your question, Ryan, yes, we're on track to apply for that, and the application is due in March of 2024. We have done a lot of information gathering from our providers and partners and communities over the last, and are continuing to do so, and we'll kind of use that as a springboard to our application.
Thank you. And then the second question I had was, it was my understanding previously that the goal was to have statewide coverage of the three-part crisis system by 2027. Is that still the goal, or is it changed at all?
Yeah, that's absolutely the goal. And we look forward to, it's going to take all hands on deck effort. So I think that, but we are looking forward to partnering with communities and providers around the state to make that happen.
Next, we have Levi Henry from Fox 59.
Majority of them got answered already, but just to double check, when it comes to accessibility, like for people with like language barriers or even like hearing and things like that, are you guys working towards that as well?
Yeah, great question. Carrie, you want to come up and answer that one?
So currently, individuals that are that speak Spanish can call 988 and press 2, which would give them the Spanish Lifeline, which is a national platform and provided at the national level. SAMHSA recently announced that they are onboarding a provider that will be able to answer calls through video phone for individuals from the deaf and hard of hearing community. And we are working with all of our call centers to ensure accessibility through language lines for individuals that are not English first speakers.
I'm not seeing any hands raised from our virtual attendees, so I just want to pause to see if there are any additional questions.
You're receiving, I think the packet said something like 3,200 to 3,800 calls per month in Indiana. Obviously, this is, one would think, the tip of the iceberg. What kind of monthly calls? How many monthly calls are you expecting once this is as built up as it can be?
Yeah, that's a great question. I'm going to let somebody ponder and answer why I talk for a minute. I think there's a couple things to keep in mind. We have some additional resources right now as well, like we have the Be Happy and the Be Well lines that we launched during the pandemic that are also receiving some calls, and those are all connected on the Saline telephony system, and so we're able to sort of move calls around a little bit there. In terms of like how much to expect, I don't know that we're going to have a specific number. I think a lot of what we've been able to look at is how are those numbers changing from month to month, and as we see awareness, then we'll be able to, I think, better predict what the next month's going to look like. So if we see our TV campaigns and our awareness campaigns and we start to see an increase of, 1,000 or so calls a month, and we see that tracking up, then we have the ability, and again, it's the benefit of having on a single telephony system, we have the ability to in real time, look at the calls that are coming in, the numbers that are coming in, and be able to flex resources towards it. So I'll let somebody come up and see if there's any numbers that they have specifically. I will make one comment. We were talking about this earlier today. It is important for us to think about the almost 4,000 calls we get a day and how important that is. For an individual in crisis to reach out and call for help, like it is like a really important fact that we shouldn't brush over. Like 4,000 individuals reached out for help for a resource that wasn't available really from an easy access standpoint prior to the launch of 988. So we're really happy that we're there. But to your point, we know there's a lot of other folks that just don't know that it is available. And so the more that we can collectively do to raise awareness, the more that we'll see calls go up. And that'll actually, at least for a while, be a really good thing. I'm going to do it for you.
And the only thing I would add to what Dr. Rosiniak stated is that individuals that call 988 in the state of Indiana, our average talk time for someone calling 988 is anywhere from 12 to 20 minutes. So if you think about this, and when someone calls 911 for emergency help, right, you typically tell them what you need, and within minutes, if not seconds, they're dispatching the appropriate team. And so as you heard in our both of our videos, sometimes someone just needs someone to talk to. And so as Dr. Siniak stated, the more awareness that we get out and the more interoperability and communication and collaboration we have with each of our communities, we anticipate the number will increase, but to say what we think that will be is really just dependent upon the awareness and the accessibility of getting the message out to our communities.
Okay. So at that, appreciate all of you coming in, and fully expect to see in all of your articles a link to 988 and, for you all to help us carry the message as well about this important resource for everyone. So thank you all for attending today.